wonderful Thursday afternoon to you and welcome to Extra. Today we've got an important topic to discuss, land registration with our friends from Transparency International. And as always, being Thursday, we check out the thriller action movie review in Bastille Day starring Idris Elba. Let's firstly join Dr. Arno Weiner for this week's Health Talk. We have with us back on the show Dr. Arno Weiner. Thanks so much for joining me.
Thank you very much, Diane, for having me again.
So last week we mentioned a bit on family planning. Can you tell us the importance of using family planning?
Yeah, on a brief we did. Family planning, as I said, is a big issue or topic to discuss per se. On the top, I'm not that kind of a specialized area of my work. A lot of this are done by the gynecologists and obstetricians, and then people are related to the nurses. But specifically for this country, we lose a lot of our women, a lot of mothers dying from giving birth or during deliveries, and so we're looking at what are the causes, and one of the few things, and the top 5 is about family planning and spacing the number of children in the family and when to have children. These are issues that we realize that it's probably one of the core ingredients of maternal deaths in this country, which is about 730 per 100,000. Yep. So family planning is a very important topic in Papua New Guinea, especially when it comes to spacing the number of children and when to have children.
So what are some of the methods that can be used?
The methods that are used in the health system plus some other few private area healthcare facilities. The commonest one they use the injection ones, the Depo Povera, the injection ones, which last about 2-3 months, and then they go for the next one. The other ones they use are also the same, but they put on the muscles, the implants, and they also keep.
And that's for women.
That's for women.
Not for men.
That's for women. So the Depo, the injection, and then the pills they take them for every day. You're gonna be on for and every month of it. And then you have the other ones like the intrauterine device, IUDs, that they put into the womb to prevent pregnancies. But the commonest ones that is available, readily available day and night, is condom. Condom for guys and condom for the women. They also come in different size and different manufacturing, have their own labels.
You mentioned female condom, but are they readily accessible at pharmacies or at shops?
At the shops are difficult. Pharmacies, yes, only when you get prescribed, get a prescription.
Oh, so you have to have a prescription. Okay.
But other times they do. I have them available with in big hospitals, because it's not this one where it's been commonly used, you see, amongst our ladies.
And you mentioned a lot of methods that women. I realize you haven't said what methods for men that they can.
I think on the top maybe 3. Okay. The first one is you have male condom, which is readily available almost every other places. The second one is the vasectomy. They cut off this is what they call anatomical term called sperm in the cord. They cut it off and then they ligate it, they stop it from sperm to reach the woman's part during sexual activity. So
is it quite a massive surgery, or is
it's
it
not
just
a massive surgery? We can do them in the health centers and post with minimal instruments. We can do them. They call them, some of the commonest one they call is the non-scalable one. We can do it in the not necessarily the street sites, but in aid posts you can do that. Not necessarily in big hospitals. The other one is, the old traditional way of saying, coitus interruptus. But it doesn't happen all the time. When they're sleeping, when they're having the sexual activity, when about to release ejaculate, may decide to come out.
To pull out. Yeah.
So that's something, but it's unreliable, almost 100% unreliable. Yes, it is possible. But the commonest one is the condom, male condom, they use before the sexual activity. If you know that you have enough children in the family, advisable not to the woman but to the man, the husband, the father, to get vasectomy.
Vasectomy, definitely.
It's the best way to do it.
And it's also we look at. It's becoming more and more expensive in terms of if you're living in an urban area, so it's just it'd be very important, right, to make sure you do use family planning.
Apart from maternal mortality, we have expense. It's now becoming an expensive society. So the number of children from one, first, babies, they have their own, needs and wants, and you're going to look after them, school fees, and feed them, and it's become an expensive exercise.
Not that we're saying that.
We are not, but it's a reality.
It is a reality in terms of it's just spacing, so that
spacing, yeah. And then, the number of kids, you plan proper because how good your resources and, how much you can do, all this.
Yeah. And what are some of the, there's a lot of stereotypes when it comes to some of the methods you've said about the condoms, the depot, the pill. Can you just tell us, break some stereotypes?
See, when we say, the ladies, I also forgot about, it's called tubal ligation, and that's operation and you stop all your family, having children. Okay. That's also part of the family planning too, I haven't mentioned that, but what happens is a lot of people, a lot of ladies, they think about the injection, that they think that they put on weight, which is true. It's part of the side effect of this, in the hormonal treatment or the family planning tablets. It's true. But what they think is that it will stop them from doing work in the gardens or doing all this, and then plus that they will never have children anymore. That's totally wrong. That is definitely wrong.
Because you can take it out, right? When you want to have children.
Yeah. You can take it out, or you can stop after 3 months injection and don't bother to go for the next injection. So you can have your normal system come back, and then you can have your children afterwards. Great. So it is not.
Well, I mean, I think we need more time to really go in depth, and maybe on the next show you can maybe talk a bit more about this important topic. But thanks so much for joining me.
Thank you very much.